So a very wiggly Edie, probably the pan au chocolat, and I are really lucky to be joined today by Harry, who is a paramedic and is going to talk to us a little bit about her incredible, exciting career. So welcome, Harry. Could you do a little introduction into everything that you do?
Yeah, thank you. Thank you, Edie and Laura for having me. Yeah, so I've been a paramedic for about 5.5 years. I trained for 3 years prior to that, went to university in Surrey. And yeah, currently at the moment I'm working full time on frontline ambulances. And yeah, just kind of figuring out where I go next and what my next kind of move will be. But yeah, it's a great job. I feel very privileged to be able to help people in the way that we do, but also have like a job that I know I'll be secure in. You know, the pandemic really highlighted that to me, definitely.
You've had a really exciting sort of journey into being a paramedic, haven't you? So please tell us about some of the exciting things that you've done on that journey.
Yeah, I think it's definitely unique. I wouldn't say that many other people have necessarily taken this route, but I guess it's a story of anything's possible. So when I qualified, I took my dissertation from university and I had it published in a journal for paramedics. So that was like the first step in it, you know, in the what was next to come. And somebody suggested to me that I present at a conference on the findings that I had. It was basically a literature review looking at pre-hospital burn care. So when people have had like a burn injury, how we should be treating them to be like optimal outcomes and have the best survival they can have. It's not a very commonly occurring thing in this kind of day and age because we've got a lot better safety guidelines and stuff, but when it does happen it really properly affects people's lives in ways that, you know, we wouldn't even imagine if we've not been there ourselves. And it just felt really important to me to be an advocate for those patients, survivors, you know, whatever term people prefer to be used. Yeah, so anyway, it was just really exciting to be able to stand up in front of people, really nerve-wracking as a very new paramedic, and to say this is what we should be doing. But people listened and people want to learn because, you know, finding the time in a full-time job and all the rest of it to continuously like keep up with what is changing in medicine is, yeah, it is difficult. So after that, I started teaching at some universities, and it essentially just spreading the knowledge as far as I could within the time and the resources that I had. And I went back to university, which was an online course actually, to do a postgraduate, I think, yeah, PG cert in burn care. And I was the first paramedic in the UK to have like gone onto that course. It had like nurses and physios and some doctors as well. So I was really, you know, really privileged to graduate again. It was, yeah, it was great. During the pandemic, I was working alongside one of my nursing colleagues in burn care, and we set up an e-learning for burns for paramedics. And I actually did, separate to that, I also did a COVID e-learning package for paramedics, which, yeah, it was a real privilege to be able to put all of our knowledge in one place that was easy to access. Yeah, it gave me a whole new set of skills with computer usage, which I'm not very good at. So yeah, and I was shielding actually during some of the pandemic, pregnant, having my son. So it felt really important for me to give something when I couldn't physically be helping those people. in the last year to 2 years started to get my head back into like what's next. And when I went back to work, I went back to work full time, and then I took it's like a secondment where 50% of your time is spent on an ambulance, 50% of your time is doing research.
Wow.
Yeah, I mean, pre-hospital research, there's just not enough of it, and it's really difficult to do, but it's so interesting. I won't. I mean, yeah, it's not a very like common job role, and a lot of the time it is only a part-time thing because yeah, you can't predict like the nature of the data you're going to get and how many participants and all the rest of it. But the particular study that I was working on was we basically were looking at cardiac arrests that happen outside hospital, and for those cardiac arrest patients, it was like a randomized controlled trial to see whether they got access to their veins via a cannula into their arm, or whether they had a cannula drilled into their bone, which sounds pretty grim, but it's a really clever way of getting medicine into somebody who is like completely unconscious or dead, because the absorption through the capillaries in the bone mean they get into the systemic circulation pretty quickly. Yeah, I mean, it does look like a medical torture device, and it quite literally makes the noise a drill would make. But they don't feel it, obviously. And if somebody was conscious, I have been told, I haven't experienced, that the actual drilling bit isn't the painful bit; it's the pushing things into the bone marrow.
Wow.
But yeah, so
at that point, like if they didn't have that done, then potentially it's fatal.
yeah, definitely. And I think it's become more of like a go-to solution now than it ever used to be, because as research has gone on and we've realised like the utility of it, that it's taken off a lot. So when you're putting a needle into somebody's vein, you're reliant on them having good veins, good blood flow. And if somebody is in cardiac arrest, then they're quite likely not to have that. So, or if somebody's having a seizure and you're not able to keep them still and it's not safe, then sometimes that is the best option. Anyway, the research was. Go on, sorry.
No, that I was just saying that's incredible. And is that something that are many paramedics trained to drill into the bone to administer?
Yeah, so like any paramedic, that is part of like your skill set as a paramedic. So like hands-on skills wise, like the thing that differentiates like a paramedic from an emergency care support worker, emergency care assistant, what the lay public would call an ambulance driver, the thing that differentiates them is obviously your university education and your background understanding of the science, the pathophysiology, disease process, etc. But you're able to administer emergency medication. So generally, you either have to have a prescription, or you have to be in like an emergency setting to receive that medication. There's lots of complicated laws around it. So we can give like paracetamol tablets. We can give sugar gel to people that are having like diabetic episodes. There's very basic sort of simple pharmacy kind of medication at one end of the spectrum, and all the way at the other end we've got things like intravenous morphine, which goes directly into the vein, like really quite strong pain relief, basically. We have diazepam, which we would give to mainly to people having seizures to stop them, or potentially if somebody's taking a lot of cocaine, that can put them into spasm in their heart. So we can do stuff like that. You've got cardiac arrest drugs. We can give paracetamol into the vein, which combined with morphine has like a really beneficial pain relief effect, which is cool. I think that's probably one of the most satisfying things for me on a day-to-day is if I go to a patient who is in pain. That's not the satisfying bit, obviously. The satisfying bit is being able to like treat them, and you know, we rarely completely get rid of people's pain because the source of the pain is what needs to be addressed at the hospital. But like to just be able to help someone feel that bit more comfortable, honestly, one of the biggest privileges that I feel like I get from this job. So
I didn't realize how like the academic research side was so closely linked with paramedic, you know.
Yeah, definitely. I think so. There is a shift in the paramedic kind of workforce where 20 years ago people would they would do what's called like an IHCD qualification. So they would learn on the job. They would become a paramedic through a training school of 12 weeks. And back then things were, they're not as advanced as they are now. Like you splint somebody's limb with like a bit of wood and tie it to it, and now we have these like things that self-inflate and Velcro and like crazy. But anyway, so that is where the kind of misconception about being an ambulance driver comes from, because a lot of the time they did have these extra skills, but mostly it was safer and easier for them to just drive on blue lights, pick up the unwell person, stick them in the ambulance, get them to the hospital. And back then, like the workload was made up of emergencies, and they would have time between those emergencies to not do anything, and to like rest and recover and things. But the NHS and emergency care is like massively shifted in that time. So now, and that's where the importance of the university education comes from, because we aren't ambulance drivers. We are autonomous medical professionals who don't have like, a senior to say this is what you need to do. Like sometimes you get like advanced paramedics involved, but most day to day, I'm responsible for my colleague and for the patient and for their family. We're making quite complex decisions, particularly, in COVID and post-COVID, about the actual safety and risk of taking people to hospital, kind of list that we have available to us. Like you need to understand how it works and what you're doing, because you could potentially kill somebody by giving them the wrong thing. So giving someone too much morphine and then they stop breathing, like I think the academic stuff is not really spoken about much, but it's really important for like the general understanding of what you're doing. And it's called like, I guess this is in lots of professions, but like evidence-based practice is like supposed to be where we sit. But I was really interested in research from like university, because most of the lectures were, but we had this one guy come in to talk about research. He was a paramedic, really intelligent guy, and he said our guidelines that we follow during a cardiac arrest, so somebody is dead and you'll provide life-saving treatment, only 1% of those guidelines are based on high quality scientific research.
Wow.
The rest of it is either low quality, or it is quite literally, well, we think that this will work, so let's give it a go. And that just blew my mind. And so I think that is obviously shifting and changing, and there is a lot more strong research going on, like that cardiac arrest study that I told you about. 13 ambulance trusts across the UK are doing this randomized controlled trial, so it's got a massive data set. They're going to recruit something like 15,000 cardiac arrests. They're capturing lots of data, like the effectiveness and the patient survival, all the number stuff, but then they're also doing interviews with people that survive which I just think is like, what a privilege. We had one survivor over the time that I was doing this role, and we went into the hospital and consented him to basically, like, for us to find out about his actual quality of life, not just, oh yeah, he survived, brilliant, but actually did he survive and have a good life? Because it's not just about, you know, the numbers, it's also about putting the patients at the center of it. So yeah, I just, you know, I could honestly talk about research and burns and paramedics for hours, and you know, I go into work and most of the time, like occasionally I'll have a shift where I'm tired, I'm stressed, people are rude, you just kind of like job to job, or you're waiting for hours to get support, and that stuff is difficult. But for me, the amazing things that come out of my job are way more positive. Like, so I recently moved where I work, and in the first month of working there, I had such a whirlwind of different patients and jobs, and it really reminded me like why I came into this job. So we had, I'm just trying to randomly pick off the top of my head the sort of things that we did, just give you an idea of what.
Yeah, that'd be really useful.
So elderly fallers, like people in their 70s and above who fall over in their own homes, that's quite a common thing. When the service is really busy, it's quite sad because those people get left on the floor for long periods of time. So if they don't have an ambulance, quickly, and they're either unable to get up or they're injured. I think the longest I've been to somebody on the floor where we knew they were on the floor was maybe like 7 hours.
Wow.
Yeah, but also, we potentially find people when they've been on the floor for days before they were able to get any help. And that's a really difficult part of the job because, it could be a simple solution had we got there quicker, but actually a lot of our time is taken up with people who've got minor injuries or social care problems, so stuff that could be managed differently, but often falls to an emergency response because we are quite literally the only service within the NHS who can't turn people away, who have to be available 24/7 and will come to your house. So there is stuff that we can do to help people at home. And Christmas Day just gone, I was able to basically diagnose somebody with a chest infection, speak to a doctor to get them some antibiotics, some steroids, an inhaler, and then they were left at home, and he was able to enjoy his family with his family.
Yeah.
His Christmas with his family. So, like sometimes those more like medical jobs or people staying at home is equally as important. Yeah. And then there is like the more blue lights running around like headless chicken side of the job, which is, I honestly promise you, it's very few and far between. But my second day in my new place of work, we had a guy in cardiac arrest who just sort of quite suddenly became unwell. He had a temperature, I think, and then struggling to breathe. So his wife an ambulance, and then on the phone to the ambulance, he stopped breathing. Oh. So so when we got there, we do chest compressions, we like ventilate, so breathe for him, drilled into his leg and gave some drugs to try and get the heart activity restarted. And it was unsuccessful. He didn't have a huge amount of medical history, but his family were, they were incredibly grateful for what we did, and actually they felt like letting him die peacefully at home, well, not peacefully, but at the end of our attempts to put him back into bed and to let them sit with him in his home was way more important to them than us trying to get into the hospital. And
But I think the way you describe it, of how you're making decisions with the family, you're being really respectful, like giving them that time afterwards and putting him back into bed so that they can say goodbye. That's their lasting memory of what happened. And actually the dignity and the care and compassion that you're showing them is so important. That's, is that something that they kind of prep you for, or is that something that you...
They definitely do, like within the university kind of spectrum, they definitely do cover, like the management of things like end of life care and recognizing life extinct and breaking bad news to families. Like that is covered, but I would say there is so much to fit into a 3-year university degree that a lot of things are kind of touched upon, and then you're directed to research, learning resources, stuff like that. So a lot of your learning comes from yourself. And then when you've got your placements, so where you're like an extra person on the ambulance, you're also being exposed to this stuff. I definitely feel I always describe being a paramedic as like learning to drive a car. So your driving lessons and stuff like that is like the university bit, but where you actually learn to be a driver and learn to be a paramedic and do these things is like in practice.
Like they give you the initial skills, but you're continuously developing through all of the the research. Like it's incredible. And so this, was it a secondment that you're on where you're partially, and so is that common for that to happen, or
it's not very commonplace at the moment? Like there are various different types of secondments that you can do. So there's obviously your main paramedic role in the ambulance service, but the variety of different roles, even just within the NHS ambulance service, and I'm not even talking about stuff you could do in hospital, minor injuries, GP surgeries, the list is endless. I actually work in a prison as a paramedic, so it really, the things you can do with it is crazy. But within the ambulance service, you've got most ambulance services, you've got your paramedics, and then you have like advanced paramedics. So that could be we've got urgent care, which is more like treating infections, management of complex medical problems, suturing wounds, stuff like that in people's home. So and they do an extra 3 years at university as a master's to get all that extra knowledge, to get more medication. They can actually deliver medication to support the dying process and things like that. So that's really I think that's where paramedicine is largely moving, because we don't see so much sort of life and death in the same way. And then on the other side of the advanced paramedic spectrum, you've got like critical care paramedics. So that would be someone who specifically goes to massive trauma, maternity emergencies, cardiac arrests. So sometimes they work in a helicopter, sometimes they're within an ambulance service. It depends where you are in the UK. And I mean, I've done an observership on the air ambulance, like just for my own learning, really, and it's just crazy. Like
so many things.
Yeah, I know. To come home. Pardon?
How many years?
Oh, like 5.5 minus 1 for a baby.
Wow.
Yeah, it's been a packed time. Yeah, and I mean, again, going off on a tangent, but in that time, I've also like been so lucky to go to lots of conferences that were either where I was talking or I was funded through my research job. So then go to these conferences where all this research is presented. You've got really passionate, like incredible people in these rooms, and you're like rubbing shoulders with people that you read research papers from this doctor who is leading the way in science of cardiac arrest, and I'm just like, and then you're having a beer with him, the network event, like it's just it is mind blowing. So I've been to 2 conferences in Scotland been to a conference in Copenhagen, been to a conference in Antwerp, which I think that's Belgium, a regular geography. Where else have I been? I've been to lots of crazy places, like, and in the UK as well, like Newcastle, Oxford. There's a conference soon coming up in Dublin for burn care, which I'm really hoping to get some funding for. Mainly, you know, like to go to Dublin, but
Oh, what an amazing, I just had no idea there was so many opportunities and so many different career progression paths.
yeah.
It's so exciting. I think this is going to be so valuable, and I could probably actually talk to you all day about this, but we will definitely get you back, because I know that there'll be students who want to ask you specific questions and want you to talk about more about bits. But I was going to finish on, so obviously all the students on our online access course are doing the first bit before they get to university. So obviously a chunk of the course is sort of science and science skills, and then the other part looks at structures within the NHS and the variety of sort of more role specific things. So I guess, have you got any top tips for our students, any things, or perhaps about about the science? So Dana was saying, okay, we do have an expected level of science knowledge that we expect you to have when you get to university or midwifery. Is it the same sort of thing with being a paramedic?
Yeah, I think it's really similar actually. So in my university course, when I went, the first year of university, you're alongside the nursing and midwifery students. So you're all learning the same A&P and the same sort of medical background understanding. And that I think at the point I'm at in this job, day to day, the science behind it isn't at the forefront of my head. I'm like, right, okay, this is happening. I give this drug. Their blood pressure's doing this, and this is why. Yes. But all the time in the subconscious little cogs whirring, I think if you don't have a really good foundation for that science, it makes all the other bits really difficult to put together, because the human body is just
incredible.
It's mind-blowing, isn't it? And then you think about all the chemicals that we're talking about putting into it, and all the the various even psychological stuff that goes hand in hand. So I feel very grateful to have a real interest in biology and human biology, because I think I'd have maybe struggled a bit more. But also I know people that are paramedics that don't, science isn't their strongest skill set. I'm trying to think I'm going to give you 3 top tips. And number 1 would be, one of the most valuable skills you can have in this job is the ability to communicate well, talk to people, small talk. I talk to elderly people about how they met their partners and how long they've lived in their house. I have a very similar conversation all the time with the patients that we're with. But also being able to talk to your colleagues. You're spending 12 hours potentially with one other person in an ambulance. If you can't communicate well, I think it can really hold you back. So that is definitely number 1 top tip. People remember words way more than they remember the drugs you gave them. My second one is, you are the most important piece of equipment in that ambulance. So you can have all the the spangly defibrillators and ventilators and all the rest of it, but you are the person delivering that care. You are being compassionate to those people, and because of that, you really need to look after yourself. I've had a very exciting whirlwind sort of career so far, and long may it continue, but comes with that is lots of really challenging feelings. And we're all human. We aren't defibrillators, we aren't ventilators, we are people. So really looking after yourself in however that looks for you, but also looking after your colleagues, because it can be a really, you can have a really tough day, and they'll be the person who you have a cup of tea with. And the third thing, have fun as well. Like, again, back to being people. I don't know many people who don't find laughter medicine. Like, whether it's for yourself to like lift spirits of the crew when you've maybe been something really difficult, whether it's to put a smile on someone else's face. Like, yeah, I have a like arsenal of really bad like dad jokes that come out occasionally, particularly when we're in pain, because distraction is invaluable. So let me give you a dad joke. I'm going to end on a dad joke.
Yes, I love it.
I'm trying to think what's my favourite one at the moment. Oh, this is relevant to science, and it took me a while to get it, so maybe I'll leave it as a cliffhanger for your students to figure out.
Cool.
So, Batman walks into a bar, followed by 12 atoms of sodium.
Harry, thank you so much. That has been incredible. And I'm so excited to edit this and pop it online, because I think it's going to be such a valuable resource. And I know the students on the course are going to absolutely love you and love this. So thank you so much.
Yeah, brilliant. No problem. Thank you for having me.